Daily cases breached 400 again over the weekend, with the health department reporting 433 new infections on Christmas Day, December 25, as well as December 26th. OCTA says it's still too early to tell if this increase was driven by the holiday surge. The research group adds we may be able to see a clearer picture of the COVID-19 situation once testing laboratories resume operations after the holidays and in areas hit by Typhoon Odette. And joining us now is epidemiologist Dr. John Wong. He is also the Senior Technical Advisor of the Public Health Research Institution. Good morning, Dr. Wong. Thank you for joining us. Now, this slight uptick in COVID-19 cases and, with the cases going up to over 400 a day, is this something we should be worried about?
Well, the picture is very mixed, no? On the one hand, there is a 5-day increase, and this increase persists, no, in spite of the fact that we have fewer testing now. No? On the other hand, we have been here before. No? If you remember, December 15 to 17, there was also a rapid rise, no, up to 580. But it was not sustained. No? It dropped after that. No? So we have to wait a few more days, no, to find out whether this increase is sustainable.
All right. So until when do you think we will see this uptick in cases? Like, how much time do we need to observe it to really determine what's going on?
Maybe another 9 or 10 days. No, I'd like to see a consistent 14-day increase. No, before we say that this is a surge that can be sustained. No.
All right, so some concern, but definitely no reason to panic yet. Can we say, Dr. Wong, or at least guess as to what is causing this uptick? I mean, of course, people have been gathering the past few weeks in the spirit of the holiday season, and everybody's also got Omicron on their mind. What is causing this? Do we know?
Yes. So as mobility has increased, no, and because of the holiday season, people have been gathering indoors. No? So there was a recent SWS survey that a lot of people have decided to come together, no? For parties, no? to see family again and friends. No? So if ventilation was poor, or they were not tested when symptomatic, no? They could have exposed themselves. No? And this could have driven the rise in cases.
All right. Dr. OCTA says that we may see about 1,000 cases a day come January, possibly. Will you recommend tightening restrictions after the holidays?
What I would recommend is for people to continue to observe masking and make sure na when they go indoors, no, to make sure that these are places with very good ventilation. But my most important recommendation would be to get vaccinated as soon as possible, no? Especially the elderly, no? Because they're most at risk for hospitalization, severe disease, and death, no? If infected.
All right, Doctor, we're seeing things that are happening in Europe and the United States with cases there soaring. How possible is it that will happen here in the Philippines? Is it inevitable? Are we just a few months behind them? Or are there things we can do to mitigate it?
So those surges in the Western countries are driven by Omicron. No? We have border controls in place, no? But these are temporizing measures. No? While waiting for its identification locally, no, we have to prepare our surge capacity, no, for testing, contact tracing, no, and isolation and quarantine facilities. No. But most importantly, the best way to prepare for it is to have more of the unvaccinated vaccinated. No, that's the best way to protect the population.
All right. Thank you so much for your time. As always, that was Dr. John Wong, Senior Technical Advisor of the Public Health Research Institution, Epimetrics.